And as America's opioid addiction crisis grows, telemedicine and telemental health services are emerging as valuable resources for those battling addiction. Joining me now is Dr. Paul Christo. He is an associate professor in the Division of Pain Medicine at Johns Hopkins University School of Medicine. Dr. Christo, thank you for coming on today. First of all, as this pandemic rages, how important are telemedicine and telemental health, especially when it comes to treating addiction to opioids?
Well, hugely important. And remember, prior to COVID-19, we really didn't have much access to telehealth services or telemental health services. Today we do. It's so important for those who have the disease of addiction or opioid use disorder, whatever it may be, to have access to their providers, counselors, therapists, psychologists, psychiatrists via telehealth. It's really been helpful.
So, Dr. Christo, how is COVID-19 affecting the treatment of opioid addiction?
Well, unfortunately, we've seen a rise in opioid-related deaths due to COVID-19. Last year we had about over 70,000 drug overdose deaths. Half of those were driven by synthetic opioids. Now, these are opioids like fentanyl, carfentanil, not prescribed opioids. I think that's an important difference. So we're seeing more and more people use these synthetic opioids, which are extremely powerful. Fentanyl, for example, is about 90 to 100 times more powerful than morphine, so it can easily lead to death.
So these synthetic drugs, how are people obtaining them?
Well, a lot of people are getting them on the streets, and they're buying them from the streets. And what they don't realize is, number one, is how powerful they are. Also, when we're talking about fentanyl, which is a synthetic opioid, this is being laced with other opioids like oxycodone, for example, or stimulants like methamphetamine. So patients have even a higher risk of dying if they're using fentanyl or if they're using street drugs, because these street drugs are often being laced with fentanyl.
You say there are medications available to treat opioid addiction that can actually be obtained via telemedicine.
Absolutely. And this is something also that's occurred as a consequence of COVID-19, which is quite positive. These are called medication-assisted treatments or agonist therapies. Methadone is one of them. Buprenorphine is another one. Suboxone is another one. In the past, we can only prescribe these via written prescription. But due to COVID-19, we can now prescribe Suboxone, buprenorphine by telephone or via telehealth services. And by the way, these are medications that are so important for recovery from opioid addiction, maintaining sobriety.
Dr. Paul Christo, thank you very much for joining us this afternoon.